I can say that these are examples from 3 of our partner groups, and all of the people who agreed to let me show their slides, fantastic, with their permission, would they really worked hard to create materials that are health literate and accessible, and they went through lots of challenges to do that. There are many more that could have been shown, but again, we're trying to sort of keep the time managed and also just show examples. So Barbara showed a slide that was like this to some degree when she started this morning, and it's the health literacy through the clinical trial process. The thing that I've added, and the only reason I'll keep talking about this, is I did add some bullet points to talk about the kinds of materials that could show up at each phase. I think it's important that we don't just get stuck on consents and lay language or plain language summaries. There are all these points in the middle that we can also contribute. So if we think about recruitment, we talk about the flyers, the letters, the social media messages. What do our websites look like? There are all kinds of formats to use, both print and multimedia, news releases. Every single material that comes out to talk with people about the possible study can benefit from health literate, usable, accessible language. Truly informed consent, I know Chris is going to talk about this a lot, but the points there are effective, understandable, and legal. We need to make sure that we get that all right, but it really is usable for folks. When we think about retention, how do we keep people in studies? There are study information sheets that people use. A lot of times those go in files, and people depend on verbal communications to help people understand processes. We know that that doesn't work well all the time. People need to be able to go home and take study information, look at it again, talk with the people around them. I'll show you an example of one that has some supports for people as well. Helpful reminders, text messages, all kinds of things to keep people going. As Dr. Bulwer mentioned as well, beyond the materials, showing up at people's houses and keeping them engaged too is a really nice way to do that. The results, we talk about clinical trial summaries a lot, but we're starting to hear about journal articles that should be accessible to the public and actually usable. So not only should they be able to get them from a source in full text, but the full text ought to be understandable. That would be really helpful. Evaluation processes that are rigorously evaluated but usable for people. And then, of course, the communication between all the study staff and participants as we go on. So there are probably many more, but this is a good start from our perspective. So I'm going to show you 3 materials today. I'm going to show one from sort of early on before people are recruited, during the process when they're participating, and then a summary towards the end. And this is an example of a consent form. This is from Janssen. Thank you very much for allowing us to share a public version. Janssen spent a lot of time looking at what people needed for a global consent form. They did lots of user testing and really thought about what that meant. And some of this was sort of co-designed with users, which is a really interesting process. You wouldn't think, maybe, that users cared so much about the details, but what I can tell you is when we worked with them on this form, all of the people in the focus groups really cared about the colors and the words and how heavy the lines were between the sections and how that visually demarcated the different areas and how that made them understand the difference between what happens when they're screened, which is in blue here, what happens in the treatment period, which is in green here, and what happens in the follow-up, which is in the purple period here. Those periods really mattered to them. The timelines within those periods, very often people get very confused because there are the dates before you start and after you start and during you start, and it's often on the same timeline, and it's very confusing. But if you can use the color and start to separate those out and chunk them together in pieces, the time periods start to make sense in a different way for folks. And they really appreciate that and had a lot to say. We converted paragraphs of text, obviously, here to a table to make it really visual, and used some images to help make it make sense. The interesting thing about this for an informed consent is this is not controversial, really, at all. IRBs are used to seeing tables in a lot of ways. So this is the kind of thing that you can do that makes patients and participants quite happy without a whole lot of drama. So I would recommend conversations about forms like this. Here's an example. Barbara showed this before and after a little earlier as well. So Barbara showed the after. I'm going to show you the before. The before is an injection guide for study drug or placebo with panel A, days 1 to 5, and panel B, days 6 to 10. The after is how to give yourself the study medicine. This is a Merck material that they worked really hard on. There are a lot of pieces about this as well that you can probably see that just jump out. The use of color, the boxes to chunk information, headings that really make a lot of sense for people. But probably the most dramatic piece of this is the image at the bottom, the drawings. So an actual artist drew a picture of what it likes to take the injection and how people use it. This tests really well. People understand what this means and how to hold the medicine and how to give themselves the medicine. They have both the visual image and the words to go along with it. And the drawings are quite simple culturally as well, by not using images, but by using the actual drawing as well. It doesn't make any meaning about who you are or what this means. It's a very clear example. And then I'll show you one more. This is the clinical trial summary. So the before conclusions. This is the end of the study. Someone might say something like, the results of this study indicate that statistically more patients, da-da-da-da-da. And the after, we have a couple of examples. One is at the first part of the bottom, you can see a summary of everything that happened in the study. This is what we put together on the first page of any clinical trial summary. So what we know from patients is that they're quite happy to read 8 or 10 pages of your summary after they know if a trial has happened with people like them and it made a difference. They really want to dig in, but they don't want to do that until they're certain that it applies to them. They don't want to expend the mental energy. So we put it together in a quick summary, an executive level summary for folks, again, using color chunks, clear headings and titles, but very clear information. In the example here, what was learned in this trial is just one piece. So researchers found after getting high doses of this medicine for 16 weeks, the condition was less severe in patients, and it did not show safety concerns for people in this clinical trial. So it gets all the elements that are important for safety, but it explains it in sort of a couple of sentences that seem to work well for people. We test these, and patients really understand it. So much so, this is a quote from a clinical trial user test for this actual summary. You can read what the person says, but the interesting thing to me about the backstory of this is a 35-year-old male. He has this condition. He's had it for many years. The condition he has causes painful swollen boils in his armpits and his groin area. It was so painful and disfiguring that the person dropped out of school because he just couldn't manage sort of the pain and the disfigurement in his life. He had been on antibiotics, been misdiagnosed a lot. It took a long time to figure out what was actually going on and get reasonable treatment. But what he says is when he read this summary, he understood the condition for the first time and knew what was going on with his body. So that's after being in trials, after participating in treatment for many years, after his whole life changing because of it. It took a summary that was well written to explain what was going on. And he said he felt hopeful. The understanding led to hope. And I think that's a really important piece, and I will end there.